Many patients in the course of the treatment of cancer will need chemotherapy. In fact, I would say a large proportion of patients will need chemotherapy. Chemotherapy drugs are meant to kill cancer cells, but because of their extreme ability to kill these cells, they are also toxic to many normal cells. A lot of these drugs have to be given through the veins into the blood directly. You cannot pop pills for a lot of these drugs. So when intravenous chemotherapy is given, it poses a problem because normally we give IV drugs like I am sure a lot of you would have received injections in the vein in say the elbow where you put a needle, inject the drug and you are done. Problem with chemotherapy is the drugs are relatively toxic. So as a result, they have a very bad effect on the veins and they can be painful when injected. What happens is that you can take chemotherapy through peripheral veins. These are peripheral veins in your arm or your leg, wherever. And when you inject the drug, that particular vein in which you injected the dose tends to get inflamed and blocked. So you cannot use that vein again. So if you're taking, say, 6 cycles of chemotherapy, that's a lot of injections, and you will keep losing veins over your arms. Sooner or later, you run out of veins. Then what do you do? Second problem is the injection, because it's going through a small vein, tends to get diluted slowly and therefore can be more painful to the patient. What is the solution for this? The solution is to inject the drug into a vein that is very large. And such veins are found in the chest, in the abdomen, but not in the arms and legs. So, what problems are posed in this are twofold. Number one, we want a vein or a system which will remain open throughout the process of chemotherapy. Secondly, which is less painful for the patient to undergo. The solution lies in something which is called a chemoport, also technically called a totally implantable venous access device. A lot of words. Basically, what we do is we have a chamber which can be made up of metal like titanium or some tissue friendly plastics. That chamber will be, say, about 2 3 centimeters in size. On top of that chamber, there's a special membrane, which is something like what you find in puncture proof tires in cars. If you put a needle into that, create a hole, pull out the needle, the hole seals itself. So, with this kind of membrane and this chamber, it is connected to a tube, right? And that tube is placed into a large vein, say in the chest. So, how do we do this? We place the chemoport usually in an area in the chest, very close to the vein in the neck. We make a small pocket under the skin. We put the chamber there and we pull the tube up from that pocket area into the level of the vein in the neck and we push it into the vein. And from there, it goes into the big vein in the chest. And this is the chemoport. It is a procedure which can be done under local anesthesia. That means all that we need to do is to give you injections in the neck area and the chest area to numb that part. Patient can be conscious. That means it can be done on patients without general anesthesia. And after it is done, we stitch up the incision that we make, the cut that we make to make the pocket, and the patient can immediately receive chemotherapy. A question I'm often asked is, uh, if this is so comfortable, why isn't everybody have it? And that is true. In India, the use of chemoports is not common. First of all, it is because a lot of patients feel that this is an expense that they don't need to make. But believe me, it saves you more effort and problems in the end than it causes. Because as you keep blocking off peripheral veins, you run out of veins. And then to give chemotherapy can be a big problem. And if the chemotherapy drug does not get properly into the vein and leaks out under the skin, it can cause a terrible wound to happen in the area of the injection. These are complications that a cancer patient does not need. People also ask me, so this is a foreign body under the skin. Won't it cause problems? We have had patients having chemoports for years. In fact, I recently removed a chemoport from a patient who had that chemoport for 6 years, was now cured completely of the cancer. More than 5 years had passed. So we advised removal of the chemoport, and the chemoport got removed in the same way under local anesthesia. Patient never had any problems because of the chemoport. So a chemoport is the best possible solution if you're looking at chemotherapy, I would recommend that any patient who needs chemotherapy get a chemoport. And putting in the chemoport, removing the chemoport are very safe and simple procedures and can easily be done for all patients. Patients that have put chemoports in range from 6 months old to 85 years old. That's not a problem, and it's a great solution for people who need chemotherapy. Believe me, chemotherapy without chemoport, chemotherapy with chemoport are very different experiences for the patient.
While doing the operation, while they underwent this operation for the kidney kind of cancer, they had simultaneously put the chemoport as well. This was the first time, obviously, and there was no pain or anything because they had given me anesthesia, so there was nothing as such. A small kind of a numb kind of a thing is there because they had to give me chemo for at least 6 sessions. So they said this will be there for the next 6 months or almost 6 months. As such, I didn't have any pain whatsoever. I'm going through chemo every 21, 25 days. And it's a kind of a normal procedure. It's just a kind of putting an injection and putting the medicine through that. I just lie down. Everything is absolutely okay. After 4 hours, I'm back home. Nothing. I have no pain whatsoever.